Foot drop is just kind of a general term that we use for people who lose the ability to dorsiflex their ankle, so bring the foot up, and it causes problems with gait, with walking. You have to lift your knee up high to kind of keep from catching your toes on the ground, which makes you maybe fall and lose your balance. A lot of people don't know that there are potential surgical treatments for that with tendon transfers that can potentially restore your ability to walk without a brace. There are different causes of foot drop. The most common ones that I see are either from a back injury or back surgery, sometimes from a stroke, so sometimes it's spastic from a stroke, or a head injury. I've seen it from traumatic injuries to the sciatic nerve, whether it be from a hip surgery or a hip injury, say a car wreck, where they break the hip socket or dislocate the hip, that can injure the sciatic nerve. I've seen it some with knee surgeries, with the nerve that runs along the outside of the knee called the peroneal nerve, either from knee surgery or sometimes from a knee injury. But all of those can potentially lead to a foot drop. Really the two options of foot drop are either living with it, and that's usually with a brace that will help stabilize the foot and hold it in a functional position, versus a tendon transfer procedure, which can help restore function. Tendon transfer surgery for foot drop, it really depends on what functional units you have. So you have to have something functional to be able to transfer in the place of whatever group is not functioning. The surgery itself is, it's usually about a 1 hour to 1.5 hour procedure. Sometimes you have to do other deformity corrections in the foot at the same time, which will then take a little longer. Just the tendon transfer itself, it doesn't necessarily take all that long. It's not necessarily all that technically difficult. I do make my patients with a tendon transfer procedure non-weight bearing for 2 weeks. And then if there are no other procedures done that would make it for the patient couldn't bear weight, I would let them bear weight in a walking cast for an additional 4 weeks. So, 6 weeks immobilized and oftentimes walking on it. Sometimes if there are other procedures done at the same time, where you have to realign bones or correct deformities, sometimes you can't let them walk on it for 6 weeks, but oftentimes they can. After that 6-week mark, we'll oftentimes go back into a walking boot. If they already have a brace that they've had from their foot drop, we'll get back in the brace at that point and usually start a therapy program. A lot of times you can ambulate brace-free, at 3 months, back into a regular shoe. And then as far as functional outcome, kind of what you tell people is, we're just looking to be able to walk without a brace. At the very worst, you want them to be able to be very easily braced. A lot of times they have a deformity that's making bracing difficult. With a tendon transfer, you can at very least give somebody a foot with much less deformity that's really easy to brace, with the ultimate hope that you can ambulate without a brace. And really we're just talking about everyday activities, just walking, not necessarily running and jumping and those sorts of things, but just being able to walk without a brace.